Good afternoon, everyone. Let me welcome all my viewers once again today on this live program on Beyond Sugar. As you are aware, Beyond Sugar is created for all of you so that you get right scientific information to manage your diabetes and its related complications. We are doing this today's program live on Facebook and YouTube channels of Beyond Sugar, and I am your host, Sanjeev Mehra. Not only for you, we post daily basis information related to diabetes, but also for you, we invite leading doctors from across the country who can talk to you as a friend and answer the queries which you have. In that same context, I'm very glad to welcome Dr. Lakshmi Lavanya Alapati from the city of Hyderabad today. Welcome to the program, ma'am.
Thank you, Sanjeev Mehra. Thank you, Beyond Sugar. And thank you, all my FB friends and the technical team in the background. Welcome to the program.
Great to have you. We keep on getting a lot of messages from our viewers on various subjects which they want to hear and learn about. And one such topic is how to manage diabetes through the right diet, and it's a very important subject. But before I start taking your questions, let me formally introduce Dr. Lakshmi Lavanya to you. She's a leading endocrinologist in the city of Hyderabad, as I already shared with you. She did her graduation in medicine from Vijayawada, and after that, for her masters, she went to Cornell University in US, from where she did her post graduation, and then she did her super specialized fellowship in endocrinology and diabetes from University of Iowa in US again. She's currently practicing as a consultant endocrinologist at American Institute of Diabetes and Endocrinology, Madhapur in Hyderabad. So she's also associated with some of the hospitals in Hyderabad. But ma'am, before I start taking in the questions on this topic from our audiences, let me hand over the stage to you to set the context on this, and then we move on.
Yeah. So thank you, Sanjeev ji, for your kind introduction. And I'll let you take over the most important aspects that you, on behalf of the audience, would want to know. And then I'll take over from the answering your questions.
Sure. Sure. Now, we all know that there are, some key pillars in the management of diabetes. Medications is one, exercise is another, monitoring is of blood sugar levels is another one, and diet is another important pillar in the management of diabetes. Now, ma'am, to bring straight away, onto the topic, this being an important pillar. So, what's your advice or what's your view on that? What are the key pillars of having a good diabetes-friendly diet for our viewers? If you'd like to share your thoughts.
That's a very good startup question, and also the most important and most basic, sir. And I would want to mention to you and the audience out there, and all the diabetics, especially all the family members of diabetes, people who are suffering from the diagnosis and thereafter the disease of diabetes, is we all go with certain principles of diet in taking care of diabetes. So diabetes is when somebody's blood sugar is fasting is more than 126 and HbA1c is more than 6.5, or a random blood sugar of 200 or above. So this defines diabetes. So the day people are diagnosed with diabetes with a HbA1c of 6.5, their pancreas is half done. That means the beta cells, which are the insulin making cells of pancreas, are half depleted. That means the capacity of the pancreatic insulin making capacity is half done, 50% down, the normal 100%. So people have to realize that on the day you become diabetic, you need to work on your lifestyle, which is exercise and diet, and also on top of that, good medications as per the prescription and guidance of the doctor. Now you have a choice of whether you want to pick up the medications or not on day one with a HbA1c of 6.5, because there's a great success with lifestyle modification on this early diagnostic window of diabetes. So this is the only period of diabetes where lifestyle modification actually works more than medications or insulin can. So we give a lot of predominance to eating the right diet in terms of taking care of diabetes, and in fact even reversing it or curing it. So this can happen only in the beginning, first few months or few weeks or few years of the diagnosis of diabetes, where your HbA1c is still on the lower side, and it is the beginning of the course of the diabetes. So we focus on the principles of diet, since my whole topic is all about diet. So let me focus on that. With the proportion of, we make a plate, kind of a, a round circle on our paper, prescription paper, to explain them that, let's say this is your plate, and out of your plate, a dinner plate or a breakfast plate, half of the plate should be full of salads or vegetables which are non-starchy. So we should be able to consume a lot of vegetables which are, very rich in fiber and all kinds of vitamins and nutrients, but they're not starch. They're not like, sugar rich or starch rich or carbohydrate rich. So we should be able to avoid the potato family, the potato, sweet potato, and so these are the 4 or 5 vegetables which come in the potato family. Not necessarily the beetroot and the carrot, but the potato family has to be avoided, or they should be treated as good as carbohydrates. So 50% of your diet at any day, any snack, any meal should consist of vegetables which are mostly rich in, fiber, and some cellulose, or which is a very low form of carbohydrate, which does not count into carbohydrate or calories at all. So the rest of the one-fourth of the plate, or one-fourth of the plate, should be filled with complex carbohydrates, and we prefer all the ancient, the down to earth, most humble carbohydrates that we were taking in the past, which is basically ragi, jawar, bajra, the whole wheat, and the unprocessed rice, which comes as red rice, black rice, brown rice, and all the local rice like Kerala rice, the Kashmiri rice, the Bengali rice, these are the locally grown rice which do not have, they don't go through the excessive processing of the rice, which makes them white, refined, and very good looking and very good tasting rice. So basically, an unprocessed local grown rice, which is hand pounded or unmilled or unprocessed, is what we're looking for. So that rice is, because rice is the staple food for many of us Indians. And then if you choose the other, you can go for ragi, which is a staple carbohydrate for many areas, and jawar and bajra, like Rajasthani in Rajasthan and other parts of UP. Many of them have a roti which is basically bajra roti, jawar roti, and corn based roti, not exactly the wheat one. The wheat one is a special item which is only reserved for certain days of the week, but not every day. So we should understand that refined wheat, refined rice is the major culprit for the problem of diabetes today. And also the carbonated sugars. So there's a huge list of avoid list in the carbohydrates. So when we talk about carbohydrates, we talk about all the complex unprocessed carbohydrate, cooked, and should not be more than 150 ml by volume, or should not be more than 100 grams by volume, for a BMI which is more than 25. Now, whose BMI is less than 25, they can eat much more than that. Let's say 200 ml or 250 ml, depending on their burning capacity, and also depending on their hunger levels. So, but people who are BMI more than 25, they're overweight, and those who are BMI more than 30, they're obese, and so we have a restriction of calories for this set of people. Now, when it comes to protein, we prefer plant protein, and we prefer protein which is more simple to digest and easy available, and that's all vegetarian protein as first preference. Second preference is, yes, we can consume animal protein as well in moderation. So we talk about 100 grams of cooked protein, or a palm size, like a palm size of a piece of protein, which can be like a piece of mutton or fish or chicken or prawns, or a whole egg with a yellow included, with the yolk included. So don't get into the fad of avoiding yolk for all. It does not apply to the entire population. It only applies to people who have active coronary artery disease, or LDL cholesterol more than 120, or who are not treated with statins, and they have multiple other comorbid illnesses. They should be avoiding the cholesterol part of the yolk of the egg. But avoiding yolk is not a standard norm for everyone on this planet Earth. So please consume a whole egg, and consume also the red meats such as mutton or chicken, and all the seafood also included. 100 grams of protein per meal is allowed. So it can be like a piece of chicken for lunch and a piece of mutton for dinner. So you can consume your share of non-vegetarian protein as well, if that is up to your liking and it's up to your availability and affordability. Why not? So when people have meats and red meats, they have a preferential liking to these substances, and so they consume a whole lot of it, and they don't pay attention to the 100-gram limit or the palm size limit, and they usually consume a whole lot of carbohydrate with it. So when they have a very good quality chicken, or mutton curry as a dish, so they consume more chapatis with it, or more rice with it. So that is the reason why some doctors avoid the red meats in totality. which is not scientific. I'm going according to the guidelines of American Diabetes Association and European Association of Study of Diabetes, and the DIPSI, which is basically the Indian guidelines, RSSDI Indian guidelines of diabetes, norms. So I'm being scientific in letting you know that there's no one preferential meat. You can have all the meats, or all the plant protein. For a complete vegetarian family, you can go for all the plant protein, which is basically almonds, sprouts, soya, and paneer, and all the Indian dals. And prefer the dals with the covering on it, like a whole grain, whole dal, a whole pulses, which should be basically the chilka wala dal, the whole complete granular, the complete dal, not the processed dals. So which is very good. With the chilka, or the covering of the dal, is really full of vitamins, the B complex vitamins, and so you don't need to take another B12 pill, other than the unprocessed wholesome natural foods which are grown in your area and popularly prepared in your homes. So now, when it comes to fats and oils, there's a limit of 5 grams, or a thumb size, or a limit of 5 grams of oils and fats to prepare these vegetables and protein. So when you prepare your proteins and vegetables, we prefer that the oil and fat content should be as low as possible, so that you don't it does not harm both the BMI, the heart health, and the for diabetes also, too much fat is not good, because fat destroys the beta cells of the pancreas, and it makes you much more insulin resistant. The insulin receptors on the surface of the adipose tissue, the muscle and the liver get destroyed with too much fat consumption. And fat more than carbohydrate sometimes destroys the pancreas much more, and makes the people much more insulin resistant, which comes through all these toxic free radicals which are produced by too much carbohydrate and fat consumption. So there's a whole avoid list, Sanjeev ji, and if time allows, I'll just go through that quickly, because all the
Yeah,
sugar, honey, jaggery, and all the sweet fruits, the fruit juices are not allowed for diabetics, because the fruit should be consumed unprocessed, which is basically with the peel and the fiber and all that stuff in it. We should not juice a fruit, and we should not consume any fruit which is sweet to taste. We should consume the fruits which are not sweet to taste, such as guava, dragon fruit, albakra, or the plums, the pears and the apples, which are not that sweet, which are less in sweet, which are kind of raw, and also papaya, which is not sweet at all. The sweet papaya is not allowed, because it increases your sugar to a very significant value. So we should stray away from the fruits which are sweet to taste. And who will judge that? We ourselves have to judge that. Once we taste the fruit and it is really yummy, really sweet, it is not for us. We have to forgive, I mean, we have to give it off to our family members or people whom we love, who do not have diabetes, but we can't consume it ourselves. I'm sorry to say, people love fruits here. People replace meal to a fruit, but you can't do that, because you would rather replace a meal to vegetables. And you can add a bit of fruit to make the vegetable salad more palatable. For example, you can add a few pomegranate seeds to a bowl of salad. You can add a cut piece of apple to a bowl of salad, which is not so palatable, which is not so appealable for you to eat. So fruit can be used to flavor the bowl of vegetables a bit, just to give it a bit of taste. And you can also add some lemon and some chaat masala or something, or just a bit of bundi, or a few nuts to it. You should be able to consume a whole lot of vegetables. The whole diet for diabetes goes around vegetables, vegetables, and vegetables, however you prepare it, through salads, through sabji, the Indian sabji style of, a variety of sabjis are made in India, a lot of curries are made, but you have to just limit the oils and the salts in the sabji, that's all. So you can consume a whole lot of cooked curried vegetables, green leafy vegetables, and make them in the form of sambar, or dal, or curry, or salad, and a very small amount of complex carbohydrate, cooked only 150 ml by volume, and a bit of protein and a touch of fat should complete the meal. And if you eat this way, the sugars are not going to rise, and you don't need to go back to any fat diet, crash diet, intermittent fasting, keto diet, to get rid of all this extra junk, extra chunk of fat and calories, and to come back. You don't need to do that, because this is a balanced diet, and this can be sustained for a lifetime. You can consume this kind of a plate principled diet, as I mentioned, for 3 meals a day, and you can live through it, because you'll get a good 1,000 to 1,200 calories. Out of that, 40% will be from proteins, and The rest of it is all fiber and complex carbs for your energy day to day. This will keep up the energy throughout the day because you don't need to starve for longer durations, and you'll get a wholesome diet 3 times a day. Plus, you can add some snacks also, which are fruit and vegetable such as nuts, seeds, dals. Then you can have an omelette in between, or you can have a boiled eggs in between. So these are good snacks for diabetic.
Okay, thank you so very much. I think Dr. Lakshmi has, in a very elaborate way, touched upon almost everything in the diet management, and she has also, helped us understand that how the meal plate should look like. She has emphasized the importance of vegetables. 50% of the plate should be, filled with that. She also emphasized on the importance of, unprocessed, not very fully processed food, and emphasized on millets, kind of, complex carbohydrates, which can be one fourth of your plate, which is very very, I think, informative for all of us, ma'am. Thank you so very much for doing this, elaborate thing to us. Also, please highlight to us, ma'am, that is there any role of the timings of the meal or the portion size at during that time? Does that also play an important role in diet management or on the impact of blood sugars?
Very good point, Sanjeev ji. That's a very good observation, in fact, because people do ask us what importance is it to skip a meal or to delay the meals, or to have 4 meals a day. So earlier in the historically, when we were treating diabetes and understanding diabetes in the earlier days, we used to predominantly give importance to portion control, smaller portions of carbohydrate, and more frequent meals. Like for instance, we used to say have a breakfast at 8 o'clock and have lunch at 12 and have another evening snack at 4 and again a dinner at 8 p.m. So 4 meals a day was our norm to kind of suggest. But these days, there are so many other diets which have been into research, which is intermittent fasting, only 2 meals a day, 7 a.m., 11 a.m., or make it accordingly, 2 meals a day with the longer gaps of fasting here. And the other diet has come up as a keto diet or Atkins diet, which is mostly, completely avoiding the carbohydrates to reverse the diabetes or cure the diabetes in many instances, along with obesity, it can do a whole lot. So a lot of diets have come into play. So I would usually what American Diabetes Association guidelines is have at least 2 meals in a day, and then keep your energy levels balanced, so you don't have too much, a whole lot of carbohydrates in one episode and you starve for a longer time is not a good idea. So have your balance still in place, which is the plate method which I just mentioned should be kept in balance, even though we are having 2 meals, which is 7 p.m. and 11 a.m., let's say. Now longer durations of fasting in between the 2 meals, which is called intermittent fasting, what it does to the body, the good stuff is, when you're not eating in between, there is no carbohydrate coming in. So when there is no carbohydrate coming into the body's system, like the gastrointestinal system, the pancreas does not have any pressure to release insulin. So the pancreas is absolutely resting. There is no insulin coming out. So, but in other words, when we are eating more frequently or just snacking all day, as much as snacks you do, that much of insulin is released every time, and you become more and more insulin resistant because the insulin is not released exactly according to the proportion of the carbohydrate. Sometimes you release much more insulin than needed, or the insulin that is released is not used efficiently by obese diabetic person because they have so much insulin resistance going on with less insulin receptors. So there is a mismatch between the using of the insulin and the release of the insulin and the food that has been consumed. So this mismatch is encouraged many times in a day when you consume too many snacks all day long. So now the experts are actually saying that intermittent fasting works great in terms of decreasing insulin resistance, and so decreasing all the toxic radicals which are produced in eating too much or too many multiple times. So this helps to not touch the pancreas and not see the grave effects of insulin resistance, which is encouraged by eating too many more times. So giving a break and complete rest to pancreas as well as gastrointestinal system, you actually get a lot of benefit from the incretin system, which is basically makes you eat less and have more satiety or fullness, and it prepares insulin only when the glucose is coming in. So incretin system is given a lot more life in this process of fasting. So we are now coming along with fasting as another method of being able to reverse diabetes or control diabetes as much as possible with diet alone. So intermittent fasting has grown its popularity through the last few years of research, and it has come into play a lot, and it is working great. And if you remember, there's a saying in Hindi also that you eat once, you become a yogi. You eat twice, you become, you eat three times, you become a rogi. But you eat two times, you become a bhogi. But you eat once, you're a yogi. That means you basically the lesser amount of food coming into your body on only one shot, but a wholesome diet in a principled way can actually put a lot of disease away. But one meal a day is not possible for people who work, who live a proper samsari life, not for yogis I'm talking about. I'm talking about regular people who all of us work and there's so much stress going on. One meal a day can't be a complete, energy balancer. So at least two meals would make it go through in a proper way. But three meals, when you do, you have to consume your fiber a lot and your complex carbohydrates very little bit, and then your proteins also back in a very, very balanced way. So there is a risk of eating more. Three times a day, if you're eating a little bit more every time, you're adding up calories and you're adding up to the trouble of the whole, So eating more meals, like four meals a day, I would say one meal can be salad, one meal can be a proper meal, again a salad and a proper meal. So that's how you can distribute. So the usually people, cardiologists and many other experts, they do talk about having a good breakfast. We don't like our patients to skip breakfast. So when you say timings of food, so if we wake up at 5, the first meal should be consumed within 3 hours of waking up. At least something, at least an apple, a smoothie or a sprout or a piece of oats or a cup of, something should be consumed like a millet ball or a smoothie, but not with very extreme fruits, but a mixture of fruits and vegetables. So we should have at least something within 3 hours of we wake up. So that is being also another school of thought that you start off with a good breakfast and then have a moderate lunch and a very light dinner. So these don't fit into any particular American Diabetes Association guidelines for food. So I think what experts are telling doctors to mention it to the patients is to take it as a case-based approach. So see what your patients, it suits the patient the best. So it is a very individualistic approach to say. So that helps the public a lot because you can meddle with your day-to-day life, and you can accommodate the diet according to your preferences and your how your work and your stress
Okay.
is related to.
Carol,
So I'm
so thank you.
curious
So
your
very, yeah.
opinion.
Yeah. You touched, ma'am, in your initial, comments about the usage of oil. It should be, cooked properly. Whatever food is there on the plate. Now, there are a lot of questions which audience has on what kind of oil is right. The people would say desi ghee is good, or some will say mustard oil or coconut oil. Can you please help us understand that which is the most appropriate oil to be used for people with diabetes?
Okay, sir. Yeah, well, there is no particular guideline on this, like a scientific guideline, but a lot of research has happened, a lot of preferences have happened, and lots of outcomes are there. So I would like to sum up everything and say that the oil also should be as less refined as it possibly can be. So all the local cold pressed oils, the local poplar oils, which are locally grown seed oils, which are in their particular areas or according to their family traditional values can be consumed. Less the oil the better it is. So unrefined or as less as possible refined should be used. So the original pressed oil such as mustard oil, peanut oil, coconut oil, olive oil, sunflower oil, these are preferred oil. Also the rice bran oil, these are the preferred oils. The original it is, the better it is. So the unprocessed unrefined oils as pressed cold pressed are the best. So the virgin oils are best. So the other thing is ghee is also good, but ghee is saturated in fat. It is saturated fat whether we like it or not. It may be homemade ghee, it may be the purest ghee, it may be your own cattle, own farm grown ghee, but still it is saturated fat. So we need to understand that it should be consumed in less quantities, especially for those whose BMI is more than 25 and those who have a high LDL bad cholesterol problems and they have family history of heart disease, and if they themselves are older in age group and if they have a family history of heart disease and acute coronary strokes in the family. So their coronary health has to be kept in mind, although it does not pose a huge hindrance to diabetic health. So we need to keep in mind that oils of all sorts should be kept as low as possible in preparing the food items for the diabetic meal.
Yeah. So you have shared with us that a person who's having diabetes. So what kind of how the meal plate should look like, and what kind of oils or what kind of portion sizes should be there, which has a positive impact on treatment or management of diabetes. What about those people, ma'am, who have comorbid situations like someone is having high blood pressure as well, along with diabetes, or high cholesterol as well? Now, these can be very common situations. So,
Yes.
are there any special dietary considerations for these group of people?
Sir, for hypertension, we need to be careful about the salt intake. The salt intake should be really low, as low as possible, if possible, to avoid salt. But if we avoid salt, also there can be certain other issues like the sodium levels could go low, or the people can get confused, delirious. So a bit of salt is okay, but it should be very less, like less than 5 grams salt in the whole day. So it's very less. It's 1 spoon for the entire day. So just a sprinkle of salt is enough for your soups and chutneys and stuff, which can't be avoided. So, and then also to keep the alcohol to almost zero, or to make it very very occasional, very very less, very very watched alcohol intake. Smoking should be cut back to completely zero for all the hypertension patients, because everything aggravates. Now, the high saturated fat should be cut back. I mean, which is saturated fats are ghee, dalda, and all those, the saturated fats that they use in biryanis, and the curry points and all the deep fried items should be avoided. Coconut, peanuts, the nuts, all the oils which are prepared also from these kind of sesame oil, peanut oil, they also can be rich in certain fats, so they should be avoided. And also the fats in the milk and curd, and um, makhan, and all this butter, the homemade butter or Indian butter, that should be avoided also, because all this will promote coronary artery disease in people with hypertension. High blood pressure itself is a big risk factor. On top of that, diabetes is coronary artery disease equivalent. People who have diabetes already are equal to having a heart attack already. So imagine, if you have diabetes, that means equal to heart disease, already existing heart disease. The risk is so high. So we can't mess with foods which increase your blood pressure and again put you at risk for having heart disease. So there's a high blood pressure along with diabetes and family history of risk for coronary artery disease. These are the careful norms. And the second point you mentioned was,
Is about people with high cholesterol levels,
yeah, high
salt.
cholesterol. People
Yeah.
again have to refrain from the high saturated fat intake, which is mostly seen in the coconut chutney, peanut chutneys, the peanuts, coconut, and all those other nuts which people are having great access to due to economic surge. We are able to afford such good quality nuts like pista, badam, and walnuts, which are very very high in saturated fats. They're good fats, but they're saturated fats, and they can go high in quantity if you consume too much of them. So very limited quantity of these. And also the fat milk, the fat in the yogurts, the homemade dahi will be loaded in fat. So be careful with the skim milk. Use skim milk as much as possible. And all the other added fats, which could be mayonnaise and cheese, and a lot of fast foods now in this economic surge, is a lot of availability and affordability to fast foods outside foods. So we should be careful. Mindfully eating, just mindfulness will keep an eye on these fats in the diet.
Sure. Thank you. So she mentions, like, this was a very common thing that anyone who is having diabetes also may have high cholesterol or blood pressure having, it is very very common. And intake of salt, as she mentioned, less than 5 grams per day. To simplify it further, if you have a family of, let's say, 4 or 5 members, so it should look like, as a together, you should not be consuming more than 20 to 25 grams in a day. And then you can calculate that 1 kg packet, how how much time you are taking it to consume, whether you are doing it in a month or 15 days. You can calculate backwards. And this is a very very important advice from Dr. Lakshmi Lavanya on this. What about, ma'am? You touched about the intermittent fasting and its benefits, but we also, a lot of time here, people with diabetes, they have, high weight as well, and their doctors will advise that, reduce weight, which will, have improved blood sugars for you. And many people have questions on crash diets, keto diets. Is it helpful for, people who have diabetes, or what's your expert advice on this?
Yes. Very good point, sir. That's very much popular these days, the crash diets. Out of that, the keto diet is much popular because people see beautiful results in very little time. So people want magical effects these days. They don't have patience to wait. They want magical results. But anything that brings magical results also reverts it magically. So once you resort to keto diet, you lose weight because you're not providing the body any carbohydrates for a quick energy consumption. So for energy, body is finding fuel from the stored fat. So the fat is burning, and the fat is burning in an accelerated way. The more and more days is going by with the keto diet. So body actually tries to burn the fat. So when you just give the fat, there is no other fuel for the body except the fats which are consumed and the fats which are stored. So the entire process of gluconeogenesis starts, which is basically ketolysis, which is basically the burning of the stored fat. And then here it's all up to the fat cycle of the whole body, the fat burning, energy giving process. And so the people start to lose weight. And once they're starting to lose weight, also remember there's no carbohydrate being given in the keto diet. So no carbohydrate, no insulin release. So there's no rise of sugars here. So in fact, insulin resistance is getting better, insulin consumption is getting better, insulin usage is getting better. So people actually cure their diabetes in the periods of keto diet. So keto diet gives people very good results of a quick weight loss and a quick reversal of sugar. So their blood sugars go low very much. So, but how long can you consume keto diet is my question to people who love keto diets. How long can you consume keto diet? Usually it goes for 2 weeks, 4 weeks, 6 weeks at the most. And after 6 weeks, people do get exhausted with keto diet because the fat can only burn to a certain extent. After that, you need energy for quick consumption of your day-to-day life, and then you have a carbohydrate craving, and you can't go on a strict keto diet after that. You have to modify it with a bit of carbohydrates to be given along with your fat. So this is how people have to modify a slow release of the keto diet in a modified keto diet, and then slowly make it to a consistent carbohydrate meal plan based on the principles of diabetic diet. Is that's how you leave the keto diet. Many people what do they do is they quickly reverse from a strict keto diet to a full blown diet of their own choice. So then a quick reversal of diabetes also comes back and the weight also comes back. So it is extremely disheartening and very disappointing for people who come back from keto diet to a regular diet. And so we advise keto diet to those people who have a huge BMI, like a BMI more than 35 or 30, and they have a coexisting diabetes, and they have coexisting high cholesterol, high blood pressure. Lot of medical problems are there, and it is all related to their weight. So having a keto diet about for 6 weeks will reduce their weight to about 6 to 10 kgs weight loss, and that reduces their insulin resistance to a great extent. It gives them a whole lot of confidence, a whole lot of self-esteem that we could take it up as a project, and we succeeded through this weight loss. So, but then after that, they need to touch base with the doctor regularly and again go with a modifying the keto diet into a proper diet method in order to not regain that weight. So they need to do this under the doctor's supervision with a good certified dietitian and a lot of psychological counseling. It's very important to have your background of psychology strong right there, because you don't want to leave the keto diet and get disappointed. And I've seen many people going into myositis, myalgias, muscle weakness, because they have not given their keto diet a good amount of protein and good amount of fiber. So and good hydration. So their cholesterol has gone up. Some of them have acute coronary stroke also. Some of them had very high triglycerides and had acute pancreatitis also. So some of them, crashed down here and there, syncopal episode of no carbohydrate intake, and they fainted here and there and had some accidents. So a lot of things happen. So we need to be careful about running a keto diet. Intermittent fasting, as I just mentioned, it works like wonders, and it is one of the scientific diets also these days to also keep the diet under control, weight under control, the sugars intake under control, insulin resistance under control. If it is possible, please go for intermittent fasting, which is much more applicable, practically applicable and sustainable for longer periods. Like you can do intermittent fasting with a consistent carbohydrate diet, principle diet for about a year or 2 years, and you can get rid of 25 to 30 kgs of weight loss. If you are much overweight, such as your BMI is like about 40 or so, you can get rid of 25 to 30 kgs weight down by a 1 or 2 years of intermittent fasting in a very disciplined manner. So keto diet is a
Okay.
crash diet, a short duration diet.
All right. So I think here you hear the expert on all three things: crash diet, keto diet, intermittent fasting. And I think you heard the views for you to follow and take guidance. Ma'am, you have touched around, I think, the all the aspects of this topic in a very, very nice and an elaborative way. I must thank you here on this. But before I conclude, this program, maybe a final question to you. You as a specialist would be getting to see so many patients, and at times patients come with a lot of queries as well. Are there any major misconceptions which are prevalent in our society or among patients related to diet management, which you would like to highlight, or let's say try and so that everyone can come over that?
Sir, people actually do not follow the proper guidance of a doctor, and they sometimes go on a YouTube or and they take up some misconceptions out of nowhere, and they catch those misconceptions more than what they should catch the diagnosis and treating and preventing complications of diabetes, such as they would resort to certain juices for diabetes, or certain let's say some insulin plant, or we consume this methi ras, or we take the karela juice, or we something else is available, some ayurvedic store. I don't mind ayurveda, homeopathy, naturopathy, I don't mind that at all, but it's not scientifically tested and scientifically studied as well, so we can't on a scientific forum can't encourage all those diets. But people, if they consume those, that's fine. But you can still contact your doctor, see where your diabetes is standing at, what you should do in a scientific manner. On top of that, you can do your whatever your belief systems allow you to, because only all those extra stuff is only a belief system, it's not a science system. So if you give importance to belief, all right, but also give importance to science, and do not let the science take the back bench. So that's what I would give. Like, people follow avoid cabbage, cauliflower for thyroid. It has no scientific significance at all, but they follow that religiously. But they do not get their TSH-FT4 tested regularly. They do not take the Theranorm tablet promptly every day, and but they follow the avoiding cabbage and cauliflower very promptly. So they take the unnecessary things, misconceptions, more promptly and seriously, rather than the scientific guidance and treatments and principles, more importantly. So prioritize your science first. And yeah, belief systems are belief systems, traditions, cultural values are okay, but do not refrain or shy away from the scientific guidance, is my message.
Yeah. So I think again, very, very important as she mentions that don't fall into a trap of unsolicited messages on social media. Take advice from your treating doctor. I think he or she would be the best person to guide you on your dietary advices. And that's a reason, when we are doing this program. So, there is a formal attachment, we do it with scientific bodies, and then, we call in the right experts for you so that you get the right scientifically backed information. Many a times, you will go to your doctor and he or she will tell you in a 2 3 minutes time, okay, this is to be eaten and this is to be avoided. And while you go back home, you may forget as well if you have not made your notes. What you can do today is, even if you have forgotten anything, you can simply go back on this program, this, hear it again, and have a clear understanding on what Dr. Lakshmi Lavanya Alapati has told. With this, ma'am, I think we come to the conclusion of this today's program. I must thank you for coming and taking out your time. I must thank all our viewers who may be watching this program in due course at their time. In case you have anyone in your home, in your family, friend circle who is having diabetes, and you think that this information or discussion can be useful for them, simply share the link of this program with them, and this program can be, or discussion can be, very, very helpful for them in managing their diabetes. Thank you so very much. And ma'am, any parting comments or final comments you have, you can share that as your final comments in summary.
Sure. Thank you, Sanjeev ji. I think you moderated this program really well. You have been an expert anchor, medical anchor, I would say, in bringing science to the society. Thanks a lot for your contributions. Apologize for my late entry into the program. Apologize the audience also for the late, startup of the FB Live as promised. I would want to share one thing to the audience right there, is to, it's all of us know how to eat. We all know how to eat, how to not eat. So, but we're unable to follow the norms. We lack the self discipline. And how to get the self discipline is to relax, to understand what we have, to accept what we have, to acknowledge what we have, to observe our weaknesses and observe our strength, and to give space to ourselves and give patience to the whole process of understanding. Our weaknesses and our strength have to be affirmed by us, only us. It's a very private, personal thing on what we choose to eat and what we choose to avoid. Do not have any feelings of guilt. Do not have any feelings of rush. Do not have any feelings of stress. Enjoy what you're doing fully, thoroughly, mindfully, and slowly you'll get there. I think it's basically a psychological relaxation that we all need to know. We all need to be aware of things that are happening, and days will be better. So don't have much of expectation with yourself, and do not try to be disappointed with the results. Many people get onto the weighing scale every day, or they check their sugars often, and they get disappointed. So I've seen my patients getting a lot disappointed and feeling guilty. When they come, they tell me, ma'am, I was wrong the whole season. It was a season full of sweets and festivities, so I've gone wrong. My A1C will be high. Don't feel guilty. Just address it, acknowledge it, accept it. Do not have denial, and always give importance to science, and give a space to yourself. You can do this. We all can. We all have done many, many good things in our life, and that's why we are all here. And we can do further. We are going back to basics of choosing the right thing. So just be mindful and be patient with yourself. Be kind to yourself. That's all I want to say. And with that, I'll take leave. And it was a great pleasure to be with all of you.
Thank you. Thank you very much. On this positive note, we conclude this program. Thank you very much, Dr. Lakshmi Lavanya, and thanks all our viewers as well. If you are in Hyderabad or nearby, you want more information and more help on this subject, you can always visit Dr. Lakshmi Lavanya. In case you are anywhere else in the country, go to your doctor and take advice and follow the advice as well. Bye bye for now. Take care, all of you.